This is an exclusive presentation of the Foreign Press Association.
Welcome everybody to this evening's broadcast presented by the Foreign Press Association. I'm your host Jeff Oppenheim. For this evening's program, the impact of COVID on vulnerable communities are Latin America and the Caribbean, the next hotspots. I'm going to introduce my panelists in just a moment, but before I do, just a few bits of housekeeping. And of course, I start off by always reminding folks that the Foreign Press Association is a membership-based organization and as such relies on memberships from viewers like you. The best way to join us would be to check our membership out online at www.foreignpressassociation.org. You can also send us an email if you prefer, fpa@foreignpressassociation.org. I also want to take a moment and just acknowledge my co-producers for this evening. They are Mr. Frank Gomez, thank you Frank, and of course Alibe Hamaker, who is an FPA Executive Board member and also a co-chair of the organization's event committee. So thank you, Alibe. I also want to acknowledge our Executive Director, Jonathan Bruce King, who's wearing a slightly different hat this evening. He is our TD for our Zoom panel this evening. He will also be helping Alibe and myself field questions as we wrap up the program. We'll be taking all questions at the end, but I encourage you, as they occur to you, go ahead and send them in. You can do that by using the Q&A section at the lower portion of your screen on your Zoom panel. We've disabled the raise your hand feature. You can also use the chat, or you can send us again an email. Someone will be standing by to receive those emails, fpa@foreignpressassociation.org. We'll be taking them tonight, these questions, in both English and Spanish, so feel free to fire away in both languages. And I think we could probably handle French tonight as well. Once again, I also want to remind you that tonight's broadcast will, of course, be recorded. And we'll post that probably in about 24 hours on our YouTube channel, which can be found by just typing into the search engine, Foreign Press Association and Foundation. I also would be remiss, of course, to not encourage you to follow us online on all the various social media platforms. You can find us across most of them with the handle of @FPA New York. And in this case, the New York is spelled out. Well, with that out of the way, I want to jump right in here and introduce my wonderful panel who are joining me virtually tonight in our digital studio. First of all, we have the Executive Director for the Pan American Development Foundation, Katie Taylor. Katie, thank you. We also have the PADF's Chief Technical Officer, Dr. Elizabeth Fox. Doctor, welcome. And also joining us, PADF's Thematic Leader for Peace, Justice, and Security and Regional Director for the Caribbean, Roberto Obando. Roberto, welcome. Well, let's jump right into the conversation because obviously this conversation is as deep and vast as the region that we're talking about is geographically spread out. And of course, I know PADF has been very involved for quite a number of years in the region, working very diligently on the ground across the board, a lot of efforts. So I want to ask each and every one of you for your professional assessment. We're hearing a lot at this point with World Health organizations coming back to us and saying Latin America and the Caribbean are going to be the next COVID hotspots. Now, let me ask each and every one of you, from your specific area of expertise, how real is this concern? Should we worry?
Well, Jeff, it's very real, and we do need to be careful. Right now, across the Americas, there are over 4 million cases just in the Americas. Half of that is the United States, but the other half is Latin America and the Caribbean. And just to give you a sense of how quickly it's progressing, 9 days ago, I have the data from June 9th, we were at 3.5 million cases. So in 9 days, we've increased by 500,000. And the speed, Brazil alone is almost 1 million cases. So although many governments have tried to do a lot of good things, and we can talk about that in the course of this conversation, it is a real concern. The Pan American Development Foundation has had to pivot very rapidly, like many organizations. We had to move seamlessly and quickly to telework. but we support vulnerable communities, many of whom are among the digitally excluded, many of whom work in the informal sector across Latin America and the Caribbean. So people are suffering not only from health consequences, but from many other social and economic impacts of the disease. So we'll be happy to get into some of those details, but it is a real concern, Joe.
Thank you. Dr. Moss?
It's a real concern. Katie's right. The health impact is the story we see on the top, but the economic impact has been devastating. The impact on the informal economy, the impact on nutrition, and then things we maybe should have expected, the impact on inequality, and the impact on violence. And Roberto's going to speak a lot on that. So it's a real concern.
Thank you, Dr. Fox.
Yes, so from the thematic area that I lead at PADF, peace, justice, and security, we can certainly say that COVID-19 is a real concern. Most people are familiar with the health challenges, but COVID has found a region in which weak justice sector institutions have been tremendously affected. For instance, law enforcement has been used to support emergency response. The courts have stopped working regularly, which will increase the already significant backlog of cases that they have. Prisons are among the places with the highest risk of contamination, not only for the inmates, but also for the communities where visitors, employees that go back, at night to their homes live. So all of that makes us reflect on the already existing conditions. Self-confinement in some of the urban slums across the region is extremely difficult. And for that, many governments have used law enforcement to try to make sure that the measures are respected by the population, which brings additional challenges in terms of the dynamic of security apparatus and the civilians, if you will.
Mr. Obando, I want to come back to that in a little bit too, but let me go back to something you referenced, Ms. Taylor, specifically Brazil. We're obviously looking at Brazil as one of the region's leading indicators here. And in many ways, that country can't find its way out of the news for a lot of reasons at this particular time. But I want to know, even though that's not a region that PADF is currently working in, what are the lessons to be learned there that you are working diligently to apply?
There are so many. We certainly believe that from challenge comes opportunity. We have extensive in-country networks across every country in the region. For us, we've had to leverage our networks and new networks to do quick programmatic adjustments, right? We've all moved as much as we can to virtual work environments. At the same time, we still need to get urgently needed supplies to the field. And that's everything from personal protective equipment to frontline healthcare workers, as well as core nutrition and kits to families in need who have not been able, either because of local regulations and lockdowns or through a disappearance. Their livelihoods have evaporated and they may not have the wherewithal to just buy basic necessities. We know that domestic violence rates are up. That's sort of the corollary of what Roberto was talking about. We know that the gender impact is huge. Many of the people most impacted in terms of livelihoods, in terms of frontline health workers, are women. So there are a number of repercussions. However, what we have also seen is a groundswell of our partners and networks, whether they're local, national, international, come together to creatively try and find solutions. We're moving our STEM education programs to make them virtual for those who have access and seeking digital access for those who don't. You know, we're thinking more deeply and rapidly about food security issues, about the supply chain, about public response and communications campaigns. So I believe that there is a lot of hope that has emerged, and yet there's still so much more to do.
Let's just draw down on partners there a little bit, of course, because when we think of the region, we think of politics, certainly never quite cohesive, even though we sort of lump the regions into sort of two very specific collectives, if you would, the way we are tonight. But we have volatile politics, politics in flux, politics in change, and politics that are not always dialoguing together. So how do we push past that to, especially from the role of PADF, to really get in there and use and leverage your relationships with politicians, either to work with and or work around?
So there are at least as many government responses as there are countries in the region. We believe we try to work seamlessly across all stakeholder groups. That includes local, national governments, multilateral bodies, local grassroots civil society, the private sector, be it local or international corporations. Everybody has a necessary role to play. There is no doubt that some governments have responded, as Roberto was alluding, in slightly more authoritarian fashion. Some are able to bring health measures and campaigns to bear to influence and cajole and convince people to change behavior in ways that respect rights and democracy. We also believe that it is absolutely vital, since human behavior is such a significant portion of the needed response, that governments, local, national, you name it, all actors engage with local communities, whether that's local officials or local civil society and grassroots groups and local leaders. But I'm sure Dr. Fox and Roberto have things to add on that score.
Well, let me turn to Mr. Obando. Specifically, I remember you had mentioned just a moment ago that we were looking at areas where policing was coming into play. I know we've also seen reports where military is coming into play. Talk about that balance of somewhere between power and a secondary service, if you would, of care workers and care providers.
Before we get into that, we need to understand the context. The context comes from the general idea that during the emergency, crime has gone down based on official statistical reports almost across the world, including Latin America and the Caribbean. However, we have to be careful with those statements, because as we see some crime rates going down, we need to understand that other types of crimes are going up, from human trafficking to forced recruitment of children and adolescents in conflict-affected societies, for instance, rural Colombia. Katie already referred to domestic violence. Abuse of children is also gone up. And when you have law enforcement or the military joining civil authorities on emergency response, we have to be extremely careful, because any democratic challenge needs to get resolved with more democracy, not with less democracy. And in some cases, there is a deep mistrust between law enforcement or the military and communities. So we need to balance those elements. Yes, we do have a force that can be deployed to help emergency response, and that is great. And actually PADF in several countries has historically partnered with law enforcement to build community policing and relational policing, and that's great. But we have to always be careful with the balance, because we want to make sure that rule of law, human rights, and democratic governance are at the forefront of the discussion.
Thank you. Doctor, let me turn to you now. As a follow-up to that, we're obviously very concerned that we're getting fair and accurate reporting out of there in terms of the numbers. I mean, the numbers are staggering, as Ms. Taylor just referenced, just between 9 days alone, the differential is huge. So how is PADF in there measuring and reporting on the impact, and how can they be a resource for the FPA and members of the press?
We can't be much of a resource at the government level, because those are official statistics. What we can do is the work we're doing at the community level, and also the work we're doing with a free press. And I think that's super important. One of the things that we've seen across the region is when governments attempt to tamp down on the numbers or the reporting on the numbers. So a lot of the work that PADF has been doing in terms of freedom of expression and free press and democracy is very important in terms of citizens getting an accurate account of what's going on in their countries. We also are working significantly with community organizations. And so the fact that community organizations can report their own findings to their authorities is very important. And so we try to do all our programs in a way that's going to be very evidence-based. And the evidence here is not necessarily or only on the numbers of cases, but it's on what's the impact been? How have the interventions they're attempting in the short term, the things that Katie's talked about, or Roberto, in terms of getting food to people, getting medical supplies to people, getting people water so they can wash their hands. Is that actually having an impact on the longer term financial and just physical sustainability of families and regions? So as you can see in this graph, what we're looking at are kind of immediate things we're doing at the community and the institutional level, but also the longer term impact, both individuals and or communities, and then also building stronger institutions. For example, the stronger institutions in terms of transparency and corruption, and looking at how PADF can help support civil society organizations to build those institutions stronger. So they start with COVID. They start with reporting, being honest about cases, but they go back to a more general function of free and open society and the ability to have a free and open press or have a free and open media system that can report corruption and can report transparency. Because I think this is the other factor that we're going to see. Governments and donors and banks and loans have obviously stepped up in terms of supporting the region in programs. But we have to make sure, and countries have to make sure, more importantly, that those funds are reaching the people they should. And that's the transparency on the service delivery. So evidence is a big thing at PADF. We do stuff, but we also make sure we're doing the right stuff, so we measure it.
Well, thank you, Doctor. Let's talk about one other aspect. We've really touched on certainly the vulnerable communities. We've touched on fragile economies there, certainly, but unique to that region, very specifically, are the realm of natural disasters, of which we've seen a lot over just the last decade. So how might hurricanes, earthquakes, all sorts of natural disasters, how might that threaten or compound the COVID recovery efforts?
That's a great question, Jeff. I mean, the Pan American Development Foundation has been responding to natural disasters in the region for almost 60 years now. We just requested that the Organization of American States, the OAS, convene a meeting, which we, PADF, hosted, of the Inter-American Commission on Natural Disaster Reduction, right? So we've responded to Hurricane Dorian in the Bahamas. We've responded to Hurricanes Maria and Irma in Puerto Rico, to the Volcán de Fuego in Guatemala recently. You name it, we're there. But we're there in partnership with local organizations. That's where we move quickly to mobilize networks. And the types of things, so COVID is another form of natural disaster, if you will, But to that, we need to add the shelters, the communication systems that fall apart, with a significant natural disaster, which could be a hurricane, but it could also be floods from a tropical storm. I mean, there are a number of different ways that we need to respond. And we're one of the organizations that is there frontline and center. By the way, for those of you listening, we are in hurricane season. Hurricane season started June 1. We've already had tropical storms creating major floods in Central America. If you want to help, feel free to help us at PADF.org. That's PADF, like on my screen, .org. And we would be happy to devote 100% of that funding to natural disasters and COVID response.
Well, spoken like a true executive director. So I'm going to follow up to that very specifically, because I have to imagine you make a plan going forward. This is what our year is going to look like. As an executive director, you're putting new people into place, I know, at the PADF with some wonderful new advances and wonderful programs that I'm hearing from both Mr. Gomez and Ms. Hamaker. But it had to have shifted, not only it put you and your office into double time, but I have to imagine it has put such stress on the existing programs and resources that had already in theory been allocated. Let's walk through that. How was this pivot manageable, not only in terms of human resource, but how did you have to double back down in terms of financial resource?
We are a mission-driven organization, and our incredible staff just took it in stride and has been working that much harder. So kudos to the team. But so too all of our partners, whether it's donor organizations or local partners or local governments. I mean, there are a number of people and organizations out there that have been willing to pivot with us to say, that money that we were going to use for this particular purpose, can we reallocate some of that? We've also been realizing there's a lot of power in communications campaigns, so you leveraging digital media to make sure that the messages get out there, the messages about social distancing, about wearing masks, about washing your hands regularly, which is going to be important to continue to slow the spread of the disease.
I want to go back to that. Also to what Dr. Fox said earlier, a specific charge, because in many ways you are addressing the FBA tonight, and part of our mission is to serve foreign journalists. In reaching out, let's put us to task. What is the message that has to be put out there? What is the message that may not be being heard or not being gotten right, that you can put us to task? Take us by the hand, bring us in, let us see it through your eyes. What can we do?
There are 4 things that you can report on or encourage local policymakers, get the word out, that still will make a huge difference. Unfortunately, COVID is not going to evaporate. Communications campaigns, that's number 1. If press, journalists, media can be a part of that, that would be extraordinarily helpful. Supporting communities and understanding that they can play a huge role in identification of COVID cases and in isolating and supporting those who exhibit symptoms. 3, the continuation of basic health services. If kids aren't getting vaccinated for measles, you're going to have measles outbreaks. People are going to start dying from other things because basic health services are not being provided. And finally, last but not least, we need to broaden the emergency safety net, and that has to include social and economic support to vulnerable populations. You are all, I love the press. We believe and support a free press. It is absolutely vital that there be independent voices out there. Supporting the need to bring resources to vulnerable populations.
Also should be accurate. Sorry, had to say that. I think the role of the media in not spreading misinformation. is
And I
not getting the types of messages that are going to confuse people. We saw this to a great degree with the Ebola outbreak, where media sources at times were it's where rumors begin. And so I think accuracy of reporting and understanding the big picture, but also, like Katie says, how this is really impacting people.
Mr. Obando, I know you want to chime in there, but let me just stay with you, Doctor, for a moment. How about referencing that from your perspective? You referenced Ebola, past pandemics where you've seen a certain different call and response, both politically as well as medically. What are those lessons to be learned at large that you feel you're carrying forward there in the situation at hand?
I think the first lesson is people listen and need good information. They don't always listen to national sources. They listen to local sources. They listen online, they listen or they watch. But what people understand is hugely important. I think that was a big lesson with Ebola. It was a big lesson in Latin America with Zika. I think the misinformation that spread around Zika, the panic or the bias against certain population groups that can come out of reporting. So that's really important. I think the other lesson that we learned late from Ebola, but we applied it, I think, in Zika as a region, was that responses really have to come from the community. If a community doesn't believe that Ebola is real or COVID is real, and if in the case of Ebola, if they continue to unsafe burial practices or not reporting cases so that they can be quarantined or supported. Community is a super important part of this. So I think the kind of local reporting is also crucial as a message to the media.
Thank you. Mr. Obando, did you want to add to that?
I mean, I will not comment, again, on issues that Katie and Dr. Fox talk about, the role of the media in democracy and the truthfulness and accuracy that I think are crucial. I would like to add on something that I found extremely important from the media perspective, and is to be able to better communicate at the local context. And I have encountered individuals, particularly in rural settings and peri-urban, if you will, that said that they have more access to content about what happened in their capital cities, which might be almost irrelevant to their daily lives. That decision-making information, relevant data about their mayors, their municipalities, or their provinces that are closer to what they experience as a citizen, 24/7. And obviously, I understand media consolidation and other, global and regional and country dynamics, but I think that the more the media can highlight, can become a trusted source at the micro level, as well as the macro, but also tailoring to the local context, that would be great.
To add, there's another role, and perhaps there's some overlap between the press, the media, and diaspora groups. I think the role of diaspora groups in all countries is important, both to get the accurate messages back, as well as to support the efforts, whether it's COVID response or response to natural disasters.
I'd love to drill down on that, because that is also a very particular geographical issue that we see in Latin American countries, where you have a very strong and I think a growing voice in those communities, and yet in some ways harder to reach. You have dialects, you have maybe not a digitally inclusive community, you may be up against a lot of cultural barriers there. How can we penetrate that, especially when it's all about getting information and accurate information into those communities?
That's where the hard day-to-day heavy lifting, the interpersonal trust, the networks that you've built over time, because trust takes time, come to bear. We've got to reach those communities one by one. There are according to the Inter-American Development Bank, there are 250 million people in Latin America and the Caribbean. That's about 40% of the population that is digitally excluded. So, and that means they're not getting digital messaging, they're not getting digital media, they don't have digital banking or other information resources. So there's a significant amount of work to be done. That said, there is a huge role for new technologies. And we're consistently exploring, you know, they may not have computers, but perhaps some proportion of those people have cell phones. So how do you leverage that? How do you leverage drones? How do you leverage a variety of new technologies that can make that access easier?
Something really quick around technology and media, if you will, because sometimes, you know, we tend to think in media as an established media organization, but there are stories very powerful in rural settings in which the media of the community is a WhatsApp group. And that's the regular newspaper that people read daily. And the stories that they pay attention to are disseminated through WhatsApp groups or to community radio of a small scale. So I think that those that penetration, if you will, in hard to reach populations is crucial. And it's extremely relevant because those hard to reach populations are the same populations that are victim to organized criminal groups that control large global issues such as human trafficking, illegal mining, drug trafficking, you know, and are the ones who produce the main assets that will become at some point money laundering.
So, Mr. Obando, are you working closely, I imagine, with OAS then on those things? Talk about that relationship and how there's an exchange of information there.
Well, saying PADF to some extent is saying OAS for 55, 56, 57 years. We are a proud affiliate, independent NGO of the OAS, and our offices are located in the same OAS building. We have such, you know, good levels of collaboration on a country by country basis sometimes, or at a hemispheric level for other issues. And let me just say now that, you know, we as PADF across thematic areas, not only peace, justice, and security, we have great respect for the work that the staff at the OAS do, and obviously as the organization, you know, as a whole.
Thank you.
We also work closely with different specialized segments of the Organization of American States, such as the Inter-American Commission on Human Rights, or I was on a call earlier today with the Inter-American Commission on Women, just to give you an example, and I already mentioned the Inter-American Commission on Natural Disaster Reduction.
Fantastic. Let's see if we are ready for questions with Jonathan and Olive. Do we have questions coming in? Okay.
We have several. So we have a question from Mr. Sato. Which nation is having the most challenges with COVID-19 and why?
Take myself off mute and start. There are countries in Latin America that have done everything right on COVID, and they're still having challenges. They've social distanced, they've locked down, they've got masks, they've helped their health sector. The situation, for example, in Peru. But the structural, underlying structure of the economies with 55% of workers in the informal sector and the crowding slum conditions in cities across Latin America has made it very difficult, even if you're doing everything right, to bring your numbers down. And I think there are countries, obviously there are countries that have decided that there are not going to be measures of social distancing, or the situation in Brazil, or some of the early situation in Mexico. But in the majority of the countries have been very, I would say in many cases, closer to some of the European models than they have been to what's going on, for example, in the United States. But that they do it all right, but then the numbers go south because of the underlying conditions of a very informal workplace and the real inequities that have made it impossible for people not to get out for just basic nutrition.
I would like to comment on something else, that we will see certain repercussions on the issue of peace, justice, and security, not right now, but on the near future. As economic, challenges continue, as of today, criminal groups still have, cash to survive, enough. But at some point, as economic pressures start to increase, you might see an increase in gang violence. You might see an increase on inter-criminal groups conflicts. And those challenges might not be automatic, 1 week or 2 weeks, but the conditions are medium term. For instance, the difficulty for the younger generation, I'm talking about a young person, 17, 18, who is in a urban neighborhood, very poor in Central America. If they cannot find meaningful opportunities, it's likely that they will become prey of criminal groups, and there will be recruitment on that front. So in addition to paying attention to the current COVID context, we need to pay attention to what will be happening, in 8 months, 9 months, a year or so.
Thank you.
Question from Henry. We have, if there are any plans or guidance in place in the Caribbean basin for the possibility of a hurricane or of an earthquake, and how does that fit in with, the ongoing challenges of COVID-19?
Sure. So as I mentioned, we proposed to the OAS, and the Assistant Secretary General, Ambassador Mendez, allowed us to host this meeting, this virtual meeting of the Inter-American Commission on Natural Disaster Reduction. That basically means bringing together all the stakeholders to say, how do we respond in normal times, and how do we still continue to respond in COVID-19 times? So it's everybody. It's everybody from the various the intermilitary groups that work together, because they can often help with logistics of bringing in supplies or bringing in people, to the emergency response organizations of the Caribbean, of each country, to a number of organizations like PADF that are part of that group. So we can prepare to respond, and we've got plans in place on how to do that in a COVID-19 environment. It's tricky though. I mean, it means that when there are lockdowns of borders, but if there's a natural disaster, can you send in your experts can you send in the food supplies? Will the local government, who has locked down the borders in order to slow the spread of COVID, will they be willing to allow experts to come in? And what measures would be put in place to ensure, A, that those experts are not bringing the disease, or B, that they won't contract it locally? So there are a number of ways that it becomes a bit more complicated, but the good news is there are a number of really smart people thinking about it and organizing together to be ready.
Thank you.
Around some of that, we have a question from David Michaels. As stated, some of the Latin American countries have done perhaps everything right. Why is Uruguay the oasis in the Americas?
Well, I'm not going to say it's because the Secretary General of the OAS is Uruguayan, but
I'm busy looking up the cases in Uruguay. I knew that question was going to come. Uruguay has a good public health system. Uruguay, one of the things we haven't talked about is trust. And one of the things that's super important in order for a population to respond to government directives or community directives is they have to trust them. And I think Uruguay is a country where there's trust in government. I'm not comparing to any other country, but I think it's a country that, for the most part, there's a high degree of trust. And I think this was something that was seen in some other countries where regions where there wasn't a trust in government as much wouldn't follow directions or didn't believe things. So I think that's part of it. Also a smaller population and a more developed health system. And in some cases it's luck, but I haven't been able to bring the numbers up quickly while we talk.
We've only had 849 cases.
Yeah. And I'm sure they had a shutdown, and I'm sure they respected social distancing.
Another question comes from Cheryl Kassan. As these countries tackle the current challenges, are there plans in place for future pandemics via education, stockpiling of supplies, incorporating UN SDGs, et cetera?
Just to frame it, because Dr. Fox and I both lived and worked on the Ebola epidemic in a previous life, so, and the Ebola response, there has been a global push, a global health security agenda that has been framed over the last few years to really ensure that there are the capacities to hopefully predict, rapidly, well, prevent, of course, but if something happens, to more rapidly identify and of course respond. But ideally, you want to try and do more of the predicting and the preventing, because the response, whether it's COVID or whether it's a future zoonotic disease, a disease that jumps from animal to human, or a natural disaster, we all know, certainly in the case of natural disasters, prevention is 9 times cheaper than response. Or to put it the opposite way, for every dollar you invest in prevention, you're saving at least $9 in response. So there are many plans that have been put in place. The issue is whether countries have the political will and the resources to follow them. Dr. Fox.
Yeah, thank you, Katie. And I was just going to add, in addition to the global health security agenda across countries, the international health regulations and the commitment that within those regulations countries make to report on outbreaks that occur within their borders. And that's crucial to detecting and responding quickly. And I think this is something that is spearheaded around the WHO, and it's working at an international level. But the fact that a pandemic is not a country pandemic, it's a global pandemic. And the agreements across borders and to both report on, share samples of viruses so that vaccines can be developed quickly, share the research on impact, and be transparent on data is hugely important. And in addition to stockpiling and agreeing to be more rational in terms of supply chains and medical equipment, it's also information.
I just wanted to follow up because, of course, both of you come from a very strong background with Ebola, from a previous position, of course. And in juxtaposition, I have to ask, has the American position, the U.S. specifically, the government position here, been a help or a hindrance in your work overseas, in your work in Latin America and the Caribbean?
So the U.S. government agencies with whom we work very closely, and it's a variety of agencies, from different agencies of the State Department to agencies that are part of bureaus that are part of USAID and beyond, have all been extraordinarily responsive. I mean, the civil servants who are experts in their fields understand the significance. The public health experts have all been very committed. So I would applaud the efforts of the U.S. government to date on supporting various countries and multilateral organizations.
Thank you. Mr. Obando, did you want to add something there?
Well, I wanted to say that at the same time that PADF is, let's call it busy, we're responding to the immediate COVID challenges, we are also taking the opportunity to shape positively the agenda and propose programming and policies that will make sustainable responses for future pandemics. And one example would be in the judiciary, how we are hoping to encourage countries to move court procedures to become more technologically savvy. Why don't we use more teleconference and some Zoom calls for witnesses, for experts, etc., to reduce the logs in the cases that sometimes are 5-7 years. In the case of the prison, for instance, I mentioned we not only hope to address COVID, in the next couple of months, but we hope that the prison system throughout Latin America and the Caribbean becomes healthier, stronger in terms of their standard operating procedures, not only for the inmates, but people might not know that in any given country on a regular Saturday or Sunday, 35,000 people can visit prisons. Those 35,000 people will go back to their homes and their neighborhoods, the grocery stores, the drugstores, their churches, and they can contaminate a lot of people, not only out of COVID, but could be TB, could be other communicable diseases. So at the same time that we are addressing current challenges with COVID, we are hoping to make significant long-lasting changes for future pandemics or other challenges.
Thank you. Excellent point. Thank you. Jonathan, any more?
That's all we've got on this end.
All right, terrific. Well, I want to, first of all, thank my guests, but in closing, I also want to say, if you could briefly cite if there is one issue that we have not been able to address in tonight's brief time, and also if there's one particular need or resource that would help PADF address that.
Certainly financial resources are essential in terms of the immediate response. And again, PADF.org, we welcome all contributions. At the same time, part of what keeps us up at night is how the world is going to change after COVID, is not only responding to the current crisis, if you will, and to try and slow its spread and mitigate the social and economic impact. But there will be different ways of working. Organizations, companies will be reassessing their digital outlook, their ability to work remotely, the need for travel, how we can continue to provide digital access to the communities that we serve, how we can continue to reach them in remote ways and despite the distancing is going to be vital. So if there are any organizations out there, or if the journalists who are listening have access, the more we would love to talk to any partners who are interested. How do we continue to bring that digital access? How do we get these remote populations, these excluded populations included? How do we bring the resources to them and bring their voices to the table? Because it's not just about helping others, it's empowering the communities that we serve to help themselves, because they have the wherewithal, the intelligence, the spirit. How do we help get them the resources they need so that they are empowered and have a voice and control of their destinies?
Thank you. Doctor?
Yeah, I bring up, as Katie said, it's going to be a new future. We're seeing it in this country. Totally different workforce, totally different way of working. Despite the fact that so much of Latin America is in the informal sector, a lot of the way people work is going to change. It already has. So I think it's also important to talk about collaborating with the private sector partners and working with the different companies and the local and international, and looking at the Latin American workforce and how that now distance is not an issue. We can all do it on Zoom, as we're seeing. Increasingly, the virtual technology is going to get education, I think, out there. But thinking about how to work differently with the region and how the region can work differently. And those private sector investments and those small and medium-sized enterprises that are sprouting up with some amazing solutions to COVID are really important to support and to nurture and to link up with.
Mr. Obando.
I think that the situation for youth, particularly vulnerable youth, and adolescents, not to include children, is extremely relevant. They will have an impact not only on economic development, but they are also voters, therefore they impact the democratic governance system, and they are part of, as I mentioned, the target for criminal groups, which tend to prefer, that age range for activities. So the more attention than in the next, 5 years we pay to at-risk youth, the better, I would say. And I cannot say, I cannot prevent myself from saying that I believe that the media is so powerful and has such an important role. And my family, who might be or might not be, watching this, might say, well, you did not mention that my dad was a journalist. So I grew up, in a newsroom at the time that, the newspapers were made with scissors and glue for headlines. I read a story recently, and I will not get into the story, but the title was so powerful. The title was How COVID-19 Gave Peace a Chance and Nobody Took It, at The Economist. And my hope in the Latin American and the Caribbean context is that in several months or years, we can read an article that title is How COVID-19 Was the Catalyst for Peace, Justice, and Security in Latin America and the Caribbean. It is a difficult time, but I am hopeful, I think all of us are hopeful, that the hemisphere will rise to the challenge and it will become more peaceful and prosperous.
I also heard a lot tonight about the need for not just media in the traditional sense, as was pointed out, not just journalism, but also media at large, digital optimization, if you would. So going forward, are there particular areas, particular regions or countries that are more in need of that? And if so, where are they and what is the need?
Well, I would say there is huge inequality in, unfortunately, all countries. And the rural-urban divide is significant, but the most digitally excluded tend to be the more remote rural areas.
Thank you.
Also tend to be women, and that's important. Access to not only to internet, but to cell phones. So it's a double exclusion.
And women, of course, make up the community at greater large sharing of information, so we need to arm them
They're the
properly.
source. Huh?
There's a lot of literature on women as peace builders.
No doubt. A lesson to be learned going forward. Well, I want to thank you all for your time this evening. Thank you for joining us here at the FBA. No doubt a conversation that doesn't quite fit in the hour, so we'll probably have to revisit this, maybe check in another 9 months or so to see where we stand. And hopefully those numbers will not be going up at that time. They will be going significantly and drastically down. I thank you again, and I thank all of you listening tonight, viewing us today on our digital studio here for the FPA. My name is Jeff Oppenheim. I encourage you again to check us out online, FPA New York spelled out. And again, we'll be posting this video probably within 24 hours on our YouTube channel. You can add extra comments, questions, anything we didn't get to. I'm sure our experts will be happy to answer them the best they can. And you can also go online, as we heard, to PADF.org and send any question, information, or donations from what I heard today. When you support the FBA, by the way, remember you're also supporting freedom of the press, which again you heard today is ever vital and important globally. I'm Jeff Oppenheim, your host for this evening. It's been my pleasure. Until the next time, stay safe, stay well, and stay informed.
Thank you for joining us for this broadcast. To learn more about our digital forums and programs, please subscribe to our YouTube channel. For membership information, please visit www.foreignpressassociation.org and on Twitter at FPA New York. This has been an exclusive presentation of the Foreign Press Association.